Assalamualaikum and a very good day. I'm back to our lecture Dr. Mashara and all my fellow friends. So I am Esna Husna with my friends Nurul Amira Huda, Estelle Yukarian and Nur Shafika will conduct this recording presentation, and together we will further discussing the analysis of our main case study. So without wasting any time, let us begin. This presentation can be divided into 4 parts. So firstly, we will go through the introduction of the case study, and secondly, we will tell you how to address the communication issues, and next, we will together analyze the bed scenario case, and at the end of this presentation, we should have reflection and summary. Shortly, we have been assigned to create a case study which involve a cognitive pharmacist and agitated patient. So the idea is a group of pharmacists from Kajang Specialist Hospital had a free health screening at the shopping mall, and it was open for public. And there was a patient named Madam Latifa was came with her daughter to get a free health screening and to get the consultation from the pharmacist. But the patient had been annoying along with the session, and definitely in this presentation we will share with you what the pharmacist should do to encounter this situation. Before that, let us understand what agitated means. Based on Merriam-Webster, the term of agitated means trouble in mind, disturbed and upset. So the patient of agitation tend to show angry outbursts, excessive talking or movement, and some patients might have problem to be in conversation. It's also important for us to notice the barriers that are likely to exist during communication, and perhaps these barriers cause inconvenience during counseling session. So the first barrier was psychological. The communication is highly influenced by the mental condition the communicators are in and disturbed by the mental disturbance. For example, in this case, Madam Latifa had a negative impression toward the pharmacist in the first place and will lead to conflict within the conversation. So the second barrier was time barrier. When a patient in a rush, it can cause pressure to the pharmacist and it will reduce the communication. Besides, the key to information cannot be relayed. The third point is personal barrier. Madam Latifa did not want to share her lifestyle and her real condition to the pharmacist because she was in a deniable state when she knows the result of the health screening. She also scares to end up like her late father that was dead to hypertension. And the last barrier is attitudinal barrier, such as a bad facial expression that cause misinterpretation by others.
Mom, how about we make a quick health check over there? Come on, they're doing it for free. Why would I need my health check? See, I'm already fine. Oh, come on, Mom. A regular health screening won't hurt, right? Plus, they're doing it for free. We don't have to pay anything.
Okay, if you say so, come on, let's go.
Hi, I'm Lily. Please have a seat. I'm from Kajang Specialist Hospital. May I know your age, madam?
What? Why do you have to know my age? That is something personal.
Oh, I'm sorry for asking such question. I need to know your age because it is related to your health risk. But if it's too personal for you, then don't bother to tell.
60.
Okay, now we can proceed with the test. First, I will check your blood pressure to check whether you have hypertension or not. Next, I will check your blood sugar level to check whether it is within range or not. Lastly, I will measure your BMI to check either you are fit or you are obese.
Can you just stop talking and do your job quickly? I have other important things to do.
Please be more patient. We never force you to be here.
You better shut up. Do your job or I will complain about this to your boss.
Okay, I'm sorry.
2 hours later.
I'm sorry to inform you this, but your result shows that you have high blood pressure and slightly high blood sugar level.
What? This is nonsense. What are you saying? I'm perfectly fine and I'm healthy. Are you sure that your machines are not broken?
Please control your anger, madam. Based on the results, you do have many health complications. Well, may I know a little bit about your everyday meal?
Why do you have to know about my diet? Does it have anything to do with you?
I just want to know your lifestyle because your result is quite worrisome. You should reduce your sugar and salt intake.
What's your problem? I am very sure I have a healthy lifestyle.
It is for your own good. If your lifestyle is already good enough, then why did your blood pressure and your blood sugar level shows otherwise? Can you see the problem now?
I don't care. Your machine is broken and my health is not a problem here. You're just a pharmacist, not a doctor. You don't have any rights to comment about my lifestyle. Enough! I don't want to stay here any longer.
But mom, she's just trying to help you.
I don't want to deal with these people. They're so noisy.
Thank you, miss. I'm sorry for my mom's behalf. It's okay. Just try to advise your always correct mom.
Hi, my name is Nurul Shafika and I will explain about a proper technique to address communication issues with agitated patient. And one of the most common technique is de-escalation technique. There are some rules that we must follow. First, we must respect patient's personal space. In the case scenario, Miss Lily must always keep a distance with Madam Latifah. This is to ensure that Madam Latifah doesn't feel trapped and because of some safety reasons. Second rules. Avoid from being provocative. Miss Lily should always aware on her own body language. She must be soft-spoken and speak to Madam Latifah in a comforting tone. Miss Lily should always remember to maintain a social eye contact and avoid from staring to the Madam Latifah. Third rule, establish verbal contact. Only one person should verbally interact with the patient. In the case scenario, we can see that only Miss Lily responsible to communicate with Madam Latifah from the first until the end of the screening test. Miss Lily should introduce herself first and then ask the patient name. Fourth rule, be concise and simple. Miss Lily must use simple words when trying to convey information to Madam Latifah to avoid confusion. For example, Miss Lily used the word high blood pressure instead of hypertension. Confusion will lead to increased patient agitation. Fifth rule, listen actively. Miss Lily must listen to what Madam Latifah tried to say and then try to understand what the information and summarize it. Sixth rule and the last one, be optimistic and provide hope. Miss Lily must adopt a patient-centered view and try to suggest the best way to improve Madam Latifah's lifestyle. Bear in mind, pharmacists should always be positive. Second technique to address communication issues with agitated patient is the listening technique. Pharmacists should be attentive and picture what the patient is saying. This will help pharmacists to give a proper response to the patient. Next, it is also important for a pharmacist to always keep an open-minded about the patient. Never judge or criticize the patient.
So now we're going to look at the analysis of the bad scenario between the pharmacist and the agitated patient. So the first situation is where Madam Latifah feels that
asking her age is a personal question and is something that a pharmacist should not know. So you can see the communication issues here is Miss Lily is being inconsiderate towards her patient, and instead of explaining to her the real reason on why it is important to know the age of the patient in this health check, she just insists and forced Madam Latifah to tell her age. So here, this will eventually cause Madam Latifah to feel very annoyed with Miss Lily, even when the health check is not started yet. So now we move on to the second situation where Madam Latifah asked Miss Lily to quickly do her job instead of talking, and to which Miss Lily then replied that she has never forced Madam Latifah to be there at the first place. So the issues here is Miss Lily started to lose patience towards Madam Latifah since she asked her to do her job quickly, and then Miss Lily quickly made an assumption that it is Madam Latifah's own intention to get the health check even when it is not. So the consequences is both Miss Lily and Madam Latifah will have negative impressions towards each other, and this will cause an effective counseling session hard to be established, because the patient might lose a sense of reliability towards the pharmacist, and thus make it hard to the pharmacist to solve the patient's problem. And now we move on to the next situation, which is situation 3, in which Miss Lily asked Madam Latifah to get the health check done in other places, since Madam Latifah could not accept the result of the test and started to blame the machines instead. So you can see the communication issues here is Miss Lily being insensitive towards Madam Latifah when she couldn't accept the result of the test, and this eventually shows that Miss Lily failed to calm down her patient and failed to show empathy towards her patient. So all of this will make Madam Latifah lose her respect towards Miss Lily as a pharmacist who is supposed to help her, and thus it will be difficult for Miss Lily to counsel Madam Latifah on her health problems. And next, situation 4, in which Madam Latifah gets really angry when Miss Lily started to question about her lifestyle since the result is not good. So we can see the communication issues here is when Miss Lily started to question about Madam Latifah's lifestyle, it shows that Miss Lily is doubting and interrogating Madam Latifah, who is her own patient. So the effect will be Madam Latifah will feel very uncomfortable to actually share her lifestyle and being sincere to Miss Lily, and thus it will make it hard for Miss Lily to actually identify the real cause of her health problems. So it will be hard also for Miss Lily to find the best solution to help Madam Latifah to go through her problem.
Let's look at situation 5 and the communication issues that occur in this situation. Miss Lily being sarcastic to Lisa by referring her mom as always correct mom, and she failed to clear all the problems before her patient, who is Madam Latifah, left. Besides showing negative attitude, Miss Lily also showed her inability to be professional while doing her job, since she was consumed by her emotion when dealing with patient. Since both parties are unpleasant to each other, a bad pharmacist-patient relationship occurs. Next, we are going to look at summary and reflection. From here, we can see that as a pharmacist, they not only need to have good communication skills to communicate well with their patients, but also need to have good relationship, which can lead to a therapeutic relationship with their patients. Moreover, they also need to be a good advisor to make sure the patient get an advice with complete information. Lastly, they also need to always practice to improve the skills, so it helps build trust in patients and improve patients' compliance. Last but not least, there are also 3 patients needs here, which are more considerate and respectful, good at compliance, which means trust and follow the instruction given, and the last is to know and understand about the medication taken. And that's all from us. Thank you.